Hello, you guys. Good evening. So I wanted to come and talk to you guys because this morning I had started in on a conversation. Of course, y'all know Just V is always causing trouble. And so Just V came in and I was trying to talk about the situation with Blueface and Nevaeh, and basically when Blueface got angry about Nevaeh asking to stream with someone else, and basically told her that if the streamer wants to know how much that she charges to stream with him, then ask him how much he would pay for some PUSSY, and he valued that at about I think $10, and then she could stream for $5, so that would be like a total of $15, right? So this morning I was trying to confine my conversation to that presentation. However, Just V had some concerns over the interview that Chrisean Rock just did with Jason Lee on Hollywood Unlocked. And so I did not look at that entire video. And I'm gonna tell y'all why. When Chrisean is going in like these downward spirals and stuff like that, sometimes it makes me not want to watch because I just see the crash out something, and I'm concerned that it'll end up being something fatal. And I'm going to tell you why. It's something she shared in the interview. So, in her interview with Jason Lee, and she's not lying about this. This is true. A lot of, like I said, this girl has had a very traumatic childhood, right? Very traumatic. And so, she told a story about her dad, right? And her dad's abuse of her mom and her. And this is the thing, her dad was abusive to a lot of her siblings. But the thing about by the time Chrisean came along was Chrisean is her dad's and mom's last child. Petey is the youngest child, but Petey belongs to Charla's new husband, right? But Chrisean is the youngest Malone child, right? And so by the time Chrisean came along, some of her siblings were already adults. And then if not, they were in their upper teens and things like that. And so Chrisean was the youngest one. And during the time that Chrisean was born, like I said, they were at the peak of drug use at this point. And so there was a lot of abuse going on in the household. Children had to be shuffled around and placed into other homes. And Chrisean and some of her siblings ended up in the home of her dad's mom, her grandmother. And Chrisean shares in the Jason Lee interview that her dad's father, who is her grandfather, this is true, that he was involved in, I guess, sexually molesting her aunt, who was her dad's sister and who was her grandfather's daughter. And that her aunt ended up becoming pregnant as a result of this problem. And because the aunt could not, I guess, like reconcile, and she couldn't cope psychologically, she was messed up, Chrisean's aunt unalived herself. And this is something that all of these kids know about. They all witnessed it. They all talk, well, not all of them, but quite a few of them talk about it. Some of the kids that don't want to talk about the things that happened to them and like growing up, they won't talk about it, right? They'll try to stop some of the other siblings who do talk about these things from talking about it. But this is a very real thing. So when I see Chrisean like doing on this bad thing and with all of these delusions and all this other stuff, it just makes me think like what happened with her aunt and what happened. And I just worry, like, will this girl end up doing something that will end up taking her out of here as a result of where she's made it to? A lot of times people think people are happy because they think they have money. Money does not make everybody happy. And I don't know, I just sometimes get worried about that. So I didn't watch the interview until Just V said something, but I did see some of the clips. So one of the things that Just V had mentioned was that she was saying that Junior doesn't have a diagnosis, and this set the internet ablaze. Okay. Just V was not only upset about it, but lots of people on the internet were upset about her saying that her son does not have a diagnosis. Hopefully my connection is okay. I hope so. So Just V wasn't the only one that was upset by this, right? And the internet is upset by her saying this, and they're like, "Oh, she's lying." And if her son doesn't have a diagnosis, how is he getting physical therapy? And so they're like, either she's lying about the diagnosis or she's lying about the physical therapy. And this is where it is important for people to understand what they're talking about. Because there are a lot of people in therapy without a diagnosis, in all types of therapy, whether it is physical therapy, occupational therapy, whether it is mental health, the mental health therapy, like they're in some type of, say, seeing a psychologist or a psychiatrist. Many of them are in a treatment or in a therapy without a diagnosis. Let me say this in the conventional sense, and I'm going to explain exactly what I'm saying, right? So of course there's a diagnosis, right? Because in order for insurance to be able to be billed, there has to be some kind of diagnosis. But when I'm saying diagnosis, I'm not saying it in the sense that you're saying diagnosis, right? And you may not even understand, like when you're going to your doctors and you see all of these numbers and codes and all of these different things, you might not even understand what they all mean or why they are all there, or you might not even really understand what you're being sent there for. But I do, right? I understand it, right? And so I'm going to try to like explain in layman's terms what I mean. So I'm going to use something as simple like fertility. Let's say fertility, right? Infertility, there are many diagnoses in order to get authorization for treatment, right? A person can have amenorrhea. They could have a tubal problem, like their tubes can be damaged or not there at all due to some medical reason, not due to elective reason, but to some medical reason. Their tubes could have had to be moved because they may have had an ectopic pregnancy, and an ectopic pregnancy could cause a rupture of the pregnancy in the tube, and then that could cause the tube and have to be removed, right? There could be an issue with premature poor ovarian reserve, right? So premature is not the same thing as poor ovarian reserve. Poor ovarian reserve would be a woman getting to a certain age, and of course her eggs are not going to be that great of a quality because now she's about to reach age of menopause. So that's a normal progression. But premature poor ovarian reserve would be when someone of a younger age that should be within childbearing years has poor quality eggs, right? All of these things are things that could cause infertility. But when you are getting approved for fertility treatment through your insurance company, the only diagnosis that needs to be presented, the only diagnosis code that needs to be presented to the fertility doctor is the one for infertility. That they don't need to know all of that other stuff. The clinical notes will tell them if something is identified, but there is something called unspecified. And so this is why we use in medical terms, there are diagnoses that we can use to say unspecified. So say someone, this is like a Maryland mandate thing, and this is different in other states, but normally states have some type of time frame. So say that there's a couple who is having intercourse for 2 whole years, and they've done all of the pre-screening, they've done the HSG, Asano HSG, they've tested their hormones, they've tested their ovarian reserves, making sure that their eggs are good, making sure that there's nothing malfunctioning with their ovaries. They've checked and their period is running on time, so they don't have amenorrhea or anything of that nature that is getting in the way of them having a baby, right? They can still be diagnosed with infertility because there's going to be a clinical diagnosis now. Now we can't come up with a diagnostic reason as to what is getting in the way of this woman having a baby. But there is a way we can get to a clinical diagnosis. And depending on where you live, depending on how your insurance company defines infertility, In the state of Maryland, they say if you have a period of 2 years that you are having active intercourse, you don't have to be with the same partner. It could be with a different partner. But if you are actively having intercourse for 2 years and you don't get pregnant one time, you are considered infertile, and it will be labeled unspecified. And so, for the sake of not getting into too many details with the insurance company about diagnoses, the standard diagnosis that is sent over to the insurance company to get approvals for treatment is unspecified, right? So, similar to just like that, I wanted to explain that to you guys so that I could take it out of the realm of therapy, in a sense, because there is treatment, right? And so, we're presenting an unspecified code to the insurance company to get an approval, but it meets a clinical definition. Okay. So, because some things meet a diagnostic definition, right? Some things meet the definition because you're seropositive, right? Meaning that a blood test confirmed it. So if there's a diagnostic test that can confirm a condition, there is blood test that can confirm a condition, or there is clinical presentation that can confirm a diagnosis. And when it is a clinical presentation, often there is an unspecified code that is used to say, listen, we don't have any diagnostic test to confirm this. We don't have any blood test to confirm this, but this patient clinically presents with this particular situation, right? And so a lot of times when that happens, it takes a long time for people to try to figure out what is the specified diagnosis. And my best way to explain that, and listen, I am not a doctor. I am a healthcare administrator, okay? If you have any questions about any of this stuff, I'm saying go and talk to your doctor, but I'm giving you some of my understanding and knowledge based on my years of being in the healthcare field and me dealing with diagnoses on a daily basis and across multiple specialties, right? So, with a lot of times, it can be very difficult to get to a diagnosis, a specified diagnosis, right? It's easier for us to get you some treatment and get you involved in some treatment based on what we see presenting clinically, right? Even though there might be some diagnostic tests or some blood tests that can confirm it, but if we can't confirm it through those things, then if we see clinical presentation, it might be easier for us to get you approved, because ultimately we want to improve your quality of life. So we will use what is necessary. If that is only clinical presentation, then we will use clinical presentation in order to try to get you approved so that you can start getting treatment, because treatment is key to having better quality of life, right? And so oftentimes that's why we use those unspecified diagnoses in order to get people active in treatment, even though we're trying to figure out still what is going on, right? And by we, I mean your entire healthcare team. It's everybody, anybody in the doctor's office is involved in your healthcare team, from the front desk person all the way to the person who takes your blood. All of us are involved in the healthcare team. And whether people believe it or not, we all have conversations about, especially when it's cases that come into the office that you cannot put your finger on. And because it might be something that a staff member might remember in another patient, that the doctor may have forgotten another patient, that could lead to finding out, okay, what is wrong? Sometimes these cases are like House. Like when you saw on House or shows like Diagnosis Medicine or any of those shows where it's difficult to get to the end diagnosis, right? Sometimes there are a lot of cases that present like that. And so in that case, it's better for us to get you in treatment so we can get you some functionability so that you can get back to what you were doing, right? So that you can either learn new skills, which is habilitative therapy, or that you can improve skills that you lost due to whatever is wrong with you, which is rehabilitative therapy, right? So you have habilitative and rehabilitative. Okay. Habilitative therapy is different than rehabilitative therapy. Habilitative therapy is teaching you something new that you never did before. Like a baby who can't walk. That's a new skill. that is habilitated for a child because they are a brand new child and they never walked before. And so in that instance, it would be considered habilitative, right? But if you are an adult who already knew how to walk, and as a result of you having something going on with your knees or your feet or your hips, and then you need to now relearn these things, or you need some assistance so that you are doing this with more dexterity, then you are going to need rehabilitative therapy. So all the terms are relevant based on where you are in life, and then where you are with what skill you're trying to acquire, right? And so generally, when you're getting physical therapy, there is an unspecified diagnosis that is sent to the insurance company generally to get you approved for those treatments if you need the approval. A lot of times with PPO plans, you don't even need the approval. We definitely send an unspecified code when that's the case, because all you need in order to get therapy, physical therapy, whether it's rehabilitative or habilitative, is a diagnosis code that is associated with pain, right? That's for physical therapy, whether it's habilitative or rehabilitative, right? So you only need a pain code. So somebody can come in there and say they got pain in the arm, pain in the hip, pain in the finger, pain in the knee. And that's an unspecified code because that pain isn't associated to some type of diagnosis. It's a diagnosis code, but it's not telling us why you have it, right? Something that would tell us why you have pain in the knee is like, I have rheumatoid arthritis, right? That code can be used in somebody where you can specify what is the source that may be causing the pain. And then you can add that code in to that unspecified code, which is saying that it's pain in the knee. Because now you're attaching that knee pain to something more, right? You're giving the foundation, you're giving the reason for where this knee pain is possibly coming from. Well, this patient is expected to have knee pain because that patient has rheumatoid arthritis. But in the reality, it's not going to really change anything when it comes to if I can get the therapy, if I only diagnose it as knee pain. I'm going to still be able to get therapy, right? That's not going to stop it, but it doesn't give a source, right? The rheumatoid arthritis gives a source of my knee pain. The fact that I have diabetes can give a source of nerve damage that can be causing me to need to go to therapy in order to deal with pain in my ankles or in my feet or in my fingers so that I can try to make them function better so that then I have better quality of life. But I could still have pain in my ankles, my feet, my fingers, and don't have a source of where it's coming from. And I'm still going to be able to get treatment for therapy, right? And so I wanted to clarify that, because for people who are saying, well, without a diagnosis, how is she getting therapy? Well, she's getting therapy because there's a clinical presentation. You're seeing a child who is of a certain age that should be able to walk, but he cannot walk. And so the diagnosis code that they could be using is simply one for habilitative care, saying that this child is of walking age. And the clinical notes would document that. The history, right, of the child would document this child is of a certain age, and age where a child should be able to walk. The child can't walk. This child needs therapy. There's no diagnosis other than the fact that the child can't walk. That's the diagnosis that they would use, because that's a clinical, the child is presenting clinically with that issue. And so he doesn't have to have an actual diagnosis. And so this made me like start to think even more about what, because, you know, I said, based on what I'm looking at, it seems like to me like there's something genetic going on. It doesn't seem like it's something that was due to her behavior, even though those environmental factors were very dangerous, not safe, and not suggested for any pregnant woman. It seems like there's something else that could possibly be happening with Chrisean Jr. And so we talked about autism. We talked about the eating problems in a child with autism. We talked about based on where they are on the spectrum, a child could possibly not be able to walk. And we talked about all of those things surrounding autism that we are seeing present in Junior, right? Which could still be the case. I am not Junior's doctor. I haven't seen Junior's medical records, nothing. But I'm going to search my mind and I'm going to expand my mind further than some of the people on the internet who come up with these theories of things that are just nonsensical. And I'm going to try to think sensical in me trying to get to some logical reason or some logical source of where this could be coming from, right? And so could it be coming from the fact that she drank? Yes. Could it be coming from the fact that she smoked? Yes. Could it be coming from the fact that Blueface beat the fuck out of her while she was pregnant? Absolutely. Right? Those are all the things that could have led to this child having some kind of issue. But to me, it just keeps tickling me saying something is genetic here. Like with all of the things that we are seeing present to us, something genetically is going on. And so I waited until I was able to look and observe some. And then I came and I talked to you guys about autism and me thinking, okay, there's something else going on, but I think there might definitely be some autism or something going on. But then there is another condition, you guys. And I think that this condition could actually be closer to what we are looking at. And this is a very difficult condition to diagnose, okay? It is a very difficult condition to diagnose. It is not a condition that when you do a genetic screening on a woman while she's pregnant that you're really going to come up with unless this condition is impacting the brain. And then due to the brain abnormality, it might lead them down another road, and then they might find it, because this is what I want to explain to you guys about how healthcare and insurance works. And me and Angie did have a conversation Saturday about how insurance companies are policing medical care, right? And that is very true. The doctor cannot just order anything for you. There is a standard for what a standard panel. This is why you have standard panels of things that can be ordered. And then if something comes up abnormal on that standard panel, then you will have another series of tests after that. But generally with insurance, you cannot have that set of tests after the standard panel unless something comes up abnormal. If everything on your standard screening comes back normal, the insurance company will not pay for you to have something else more evasive, right? Like, let me explain. So, okay, when it used to be years ago, now I think they do it standardly, but it used to be years ago that when you got an HIV test, as long as it came back negative on the antibody, that was it. You just got a negative test and that was it. And but if you got a positive HIV test on the antibody test, they would send it off for a Western blot. Now I think they are standardly doing Western blots on patients because they find that the antibody could miss it if it's not in a certain time frame. But before, back in the day, the Western blot used to be a confirmatory test. And the HIV test is not the only test that has Western blot. I believe syphilis has one too. So, but at any rate, there is always one test that you're going to have initially, and then you're going to have a confirmatory test, right? That's going to confirm the diagnosis, right? And so that is standardly what happens. You can't just walk into somewhere and say, I want to have this particular kind of test done. And if you don't present with any symptoms, and if it's not part of your screening, or if it's outside of your screening and you're not presenting with any symptoms, the insurance company is not going to give it to you. And generally, hey, purple, boo, boo. And generally, most people are not going to pay out of pocket for those panels to be run. They're not going to pay out of pocket for those diagnostic tests to be done, especially when there's no presentation. There's no clinical presentation of anything going on. And so a lot of times, this is why you cannot get to the root. This is why sometimes it takes a long time to get to the root of the matter. right? This is why autoimmune diseases outside of something like HIV. HIV is an autoimmune disease, but it is an infectious disease. You have other autoimmune diseases that are not infectious, right? And so this is what makes autoimmune disorder very difficult to diagnose. And it does not change. It does not change from adult to child. It is still the same. A child with an autoimmune disorder is just as difficult to diagnose as it can for an adult with an autoimmune disorder. And so it is very well possible that I'm not trying to make any excuses for her, but knowing the language gap, the language barrier that she would have to understand this, there are people who have college degrees that can't understand some of what I'm talking about, right? There are times when when it comes to certain things, I have to do deep research into things because I might not understand what I'm being told about something in order for me to perform my job, right? Because I deal heavily with research. And so a lot of these things are new ventures that you're embarking on, trying to figure out new things. And so if I'm told that I need to write up a reason of why we need to have certain type of equipment because of something, I have to do research to find out, okay, why is this mission critical? And so it's that research leads me to find some of these things that the physician, the scientist, or whoever, they'll let me know, but I need to be able in my mind to understand it in order for me to properly write a proposal or write up a procurement or whatever it is that we need to get it, right? And so as a result, I have to be able to understand it. And it's hard for most people to understand. Chrisean might not understand anything beyond my child can't walk at this point, because that might be all that she really knows at this point. My child can't eat, my child can't walk, my child can't do this, because it might be possible that there may be no diagnostic tests, there may be no blood tests that are presenting whatever is wrong with him. So he's going to see these therapists because he can't walk. He's going to see these therapists because he can't eat. And in the meantime, we're trying to find out what is the cause of why he can't do these things. They may be still investigating that. And that could be what she means when she's saying he has no diagnosis. It might not be that they're not looking for, they might be looking for one. They might be looking for a diagnosis. This child, I'm sure, is like the talk of the town in whatever facility he's being seen in, because these are the things that scientists and doctors, that it's like it bogs their mind when they can't figure something out, or when what they're thinking, and then they go down that road and then it doesn't lead to that, right? These things like stay on their mind. Like they'll be up at night trying to figure out, like, what is this? And so there is a genetic disorder. I'm sure there are plenty of them, you guys, but this particular one, when I looked at Chrisean Jr., I was like, it's possible that this could be the case. And if it's the case, I can tell you this: it is very difficult to get in with a specialist that treats this condition. Okay. It is at least a year to 18-month wait for anybody of any age to get in with a therapist that can treat this condition. Now, what will happen in the interim, they will treat a person with this condition for this, like, just like I told you, knee pain, arm pain, whatever. They'll do that in the interim until they can get in with a doctor that actually treats the condition. And the name of the condition, I'm going to tell you guys. I'm not saying that this is what it is, but this is something else that I thought about after looking at the autism thing, trying to figure out what other genetic disorders I can identify that could potentially encompass all of these things. And so this condition is called Ehlers. Some people say Ehlers. So it's either Ehlers or Ehlers. I most of the time hear the doctors say Ehlers-Danlos syndrome. Okay. And Ehlers-Danlos syndrome is a connective tissue disorder. It is inherited. It is genetic, right? And it affects body connective tissue. Now, remember, I told you I have rheumatoid arthritis, which also impacts connective tissue in the body, right? There are lots of disorders that can impact connective tissue, but this is a connective tissue disorder that is an inherited condition, and it impacts the joints and the skin and the flexibility, the vessels, the organs, all of these things. There are 13 types of Ehlers-Danlos syndrome, okay? And so it made me think, okay, what, based off of what I'm seeing, this could be another potential thing. Now, all I'm doing is doing the same thing that the other content creators do. They come up with all of these things, but a lot of the things that they come up with are like kind of nonsensical. I'm trying to make sense to what we're seeing, not in a justification or an excuse, but sense to what we could be seeing, right? And so Ehlers-Danlos syndrome in toddlers, it can impact their connective tissue and overall development to the point where the child does have issue with mobility, where they cannot walk, where walking can easily cause them to dislocate or injure themselves, right? And remember when I was saying, like in Chrisean Jr., where he looks very contracted in his joints, like when I was talking about all of that, like the skin, the way his joints look like, and then in people with Ehlers-Danlos, and kids with Ehlers-Danlos that have not yet started walking, they do that scooting. They do that type of scooting thing that Junior does. When I'm saying like he's not really crawling, he's taking his whole body and just like scooting around like his bottom half. He's using his upper body strength to like scoot his whole body together. So I have a video that I want you guys to watch about Ehlers-Danlos. It's a short 7-minute video that I want you guys to watch. Give me 1 second. Let me get it queued up for you. Hold on. And it's called Ehlers-Danlos Syndrome Explained Clearly. It's from the Rhesus Medicine page. You can go like, share, subscribe to that page. And I'm going to play this video for you guys. Give me 1 second. I'm trying to hurry up so I can get off to hear Sylvia this evening. So I think she said she's coming on at 7, but okay. All right, let me make sure you guys, we're on over here. And I'm gonna add to the stage and play the video.
Ehlers-Danlos syndrome is a group of inherited connective tissue disorders with 13 different forms or subtypes, the most common being hypermobile EDS, while the most dangerous is vascular EDS, that is associated with vessel and organ rupture. These syndromes are the result of a genetic abnormality in genes coding for connective tissue, or for molecules that interact with connective tissue. Examples include collagen, fibrillin, and matrix proteins, and each subtype varies with which genes are involved and to what degree. Collagen and other connective tissue serve to provide support and strength in the skin, ligaments, and bones as examples. Therefore, these genetic changes lead to 3 general biomechanical problems: ligament laxity, fragility of connective tissues, and impaired healing. A combination of these 3 can then lead to pain, reduced movement, and a reduction in cardiovascular fitness. As we said, there are 13 subtypes. Hypermobile is the most common, followed by classical EDS and vascular EDS. Hypermobile is inherited in an autosomal dominant pattern, as are the classical, vascular, atherosclerosis, and periodontal subtypes. The others are autosomal recessive. Additionally, 70% of the variation in the phenotype is thought to be due to heritability. The presentation of Ehlers-Danlos syndromes are extremely variable, both in severity and in the character of the symptoms. In general, for a diagnosis to be made, most subtypes will need either the presence of generalized joint hypermobility or skin hyperelasticity, meaning excessively stretchy skin, or atrophic scarring. Other features include joint pain that typically does not feature swelling, warmth, or erythema, and there may be muscle spasms and recurrent dislocations. There can be some subtle signs, like problems with proprioception, and there's often a history of delayed walking in infancy beyond 18 months. Around 90% of adult patients will also have flat feet. There may be easy bruising and a silky or velvety texture to the skin. The presence of a mid-systolic click may indicate mitral valve prolapse, and often there are autonomic disturbances like orthostatic hypotension, vasovagal syncope, or postural orthostatic tachycardia syndrome, where there is an increase of 30 beats per minute within 10 minutes of standing. Gastrointestinal disturbance is also common, such as heartburn, chronic nausea or vomiting, bloating, and pain that may be relieved with defecation.
Okay, so I want to stop it real quick because in that we saw like 3 things that I see presenting, like things that we can identify. So 1 is the walking issue. They discussed that. 2 was based on how his teeth. I remember Carlissa was saying something about his teeth and how they are. So the EDS, it talked about that. And then you also hear it talk about the GI issue, right? And what the GI issues could cause. And that if he's having nausea, if he's vomiting, if he's having bad bowel movements, if his stomach is irritated, this will also are also things that will make him not want to eat. And then therefore, this is why he has to use these supplements, right? This is why he's on these supplements. So I was when I was thinking of something, because we can have all of these individual things, right? And all of these individual things don't really lead us. Well, eventually, hopefully, the goal is that it would lead us to what is needed to treat him. But until you can identify what it is, you just have to treat each individual symptom as best you can, right? And so the best way to treat each individual symptom the best you can is through different variations of therapy, whether it's occupational, physical, or psychological, right? All of those things, speech therapy, all of those things are things that you would treat somebody and you would not interfere with treating them just because you can't identify the source. You would still treat them individually until, hey, just be boo boo. You would still treat them all individually until you can find the source, right? But that doesn't mean you have a diagnosis. It just means that you're presenting with a medical problem where you have an unspecified diagnosis, and it would be negligent of any physician to not treat you for what you're presenting for. So they are going to treat you for the presentation until they can try to find out what is the source. I've been on maybe about like 38 minutes. So yeah, go back to the beginning, Just B, because I was explaining to how we can get to a child being in therapy that doesn't have a diagnosis. Now, I already know, y'all, this is not to excuse or justify. I'm just telling you from a day-to-day basis that this is a normal thing. It is a normal thing for any person, whether it's a child or an adult, to be getting treatment or therapy with an unspecified diagnosis. Unspecified diagnosis means there is no source for the presentation or why someone presents with a particular problem. Like I could have a stomach ache, right? If I have a stomach ache and I go into the doctor and I say, hey, I have a stomach ache, and then the doctor does everything to try to find out what is causing my stomach ache, and they can't find out that what it is causing it, they're going to still try to do something to help me because I'm presenting with things that are a stomach ache. You say, I just don't understand how people still support her. I'm not talking about the same way they support these rappers that you can't see because they got big, brown, pretty brown eyes. Right? These rappers are going out and killing people children, but y'all just cannot believe it because they got big, beautiful brown eyes, right? So that's the same way, right? That's why human behavior does not baffle me, because human behavior is predictable. It's easy to call out why you don't see support for something you don't prefer, but then when you see support for something that you prefer and then you see something wrong with it, then you find these excuses to justify the support. But so I don't figure it out, but that's how. But I'm not necessarily. So I'm trying to identify what could be going on with Junior, and by listening to her and what she's saying. And I know everybody is saying, "Oh my God, this child is crazy." You said those baby doll eyes had me in a trick bag, but I'm not in denial. But okay, let me ask you a question: are you going to no longer listen to any Little Dirk music? Is that going to happen? Did you stop listening to Michael Jackson? Now, we ain't going to rear off into that because I know that you're very sensitive about MJ. But I'm just asking, right? And so I guess, it's some people who still believe in her. They still believe, I guess, that she's a young girl, that she's trying to find her way. She doesn't know. I'm not making any excuses. I'm sitting here trying to explain to you, because I deal in pop health. I deal with populations about health issues all day, every day long. Every day, all day long. When they say certain things, I can understand what they might be saying, where other people are ready to call out go for the witch hunt. You said I separate the artist from the art. I still listen to R. Kelly. Okay, see? And so I guess it's some people who might look at, whatever it is that she does on the daily as the same way. I don't know. But I'm just trying to give a foundation for how he might not have a source of his conditions yet. Right? So he could have all of these conditions. He's not able to walk. He's having difficulty eating. He is having trouble talking. He's clearly something with his eyes. In this EDS, in the Ehlers-Danlos syndrome, it's one that's dealing with the eyes and what's going on with his, what might be going on with his eyes. This is why EDS, Ehlers-Danlos syndrome, is something that I think is very close to that there is some type of connective tissue disorder, because when I was speaking about how his joints look, and then like I said, I did not realize it at the time, but kids who have EDS, toddlers who have EDS, they do not know how to properly crawl, because you have to think about it. So if there's a connective tissue issue with him and he gets on his knees, that could be painful. That could end up being pain. Number one, he might not even be able to get himself in position to get on his knees because of the issue. But once he's able to get on them, it could be painful. And so this is why you see them make other ways to try to maneuver their body. So we see, like when you see Junior moving on that floor, he is shuffling. It's like he's taking his upper body and he's shuffling around his whole bottom half of his body. Right? You said, I'm just baffled at how stupid she thinks everyone is. Moms were saying that baby ain't right since he was an infant. I thought they were hating, but they weren't. Like I said, it's easy when you come. Okay, let me say it like this. I know this is gonna sound nasty, but I just gotta tell the truth. A woman who grows up in a house with a whole bunch of kids, with a whole bunch of women whose vaginas stink, they don't know that their vagina is not supposed to stink. So when they come around those of us who knows that your vagina is not supposed to smell like that, and we're like, oh my God, can't she smell herself? Why doesn't she know that her vagina is not supposed to smell like that? Right? Well, that's common sense to us. That's not common sense to the person who grew up in a household of women that think that their vagina is supposed to smell like that. And more than likely, they grew up in a household of women who like that. And that's why they think it's okay. And then that's why they didn't think it was a need to get any help or take this child to the doctor to find out why does her vagina smell like that. Because they say, oh, well, all people's vagina, every woman's vagina smell like that. You get what? Do you see? You said Damon Wayans said he had a club foot. He said he's had many surgeries and still in pain, but he can walk. It's different for everyone. It's different for everyone with any condition. Like I said, no, you said no, she's been around other kids. No, you're not understanding what I'm saying, Just Be. When I'm talking about the development of kids, how kids are supposed to develop. And you're right, she has been around other kids. Some of them probably slow, just like she presented somewhat slow initially. Some of them addicted to crack and all types of other levels of things. And so all of those things impact her perception of when kids should do what in what order. Also, you're talking about someone who came from a home where she probably didn't get the proper medical care, where they are contrary to medical care. That Jesus will fix it type of idea. Like you got a whole bunch of black people who's down today. They don't go to the emergency room until they already done had the heart attack. My grandmother, she had a whole heart attack 2 times at home. She's sitting up there taking a whole bunch of tongues. Because whether people want to believe it or not, minorities have a difficult time trusting healthcare and going to the doctors and getting what they need. And that's with children who don't have an issue. You know, when that's you have a hard time getting people to go get a vaccine because they don't trust the healthcare system. They think they about to do something to them. They got a child that's bouncing off the walls and can't pay attention and off-centered, and they don't trust the people to go get them the right kind of medication so that their child to sit their ass down and can do their damn schoolwork. This is the type of environment this girl came from. I don't know if you are familiar with this, Just Be, but this girl came from an environment of people who eat lead paint chips off the windowsill. Okay? Like, stop trying to make her you or me or, you know, what you used to encountering. Like, a lot of people where she came from, in the hood she came from, they suffer from lead paint poison. Because they had to live in homes that were not, like, the best. Like, she had 2 crack-addicted parents. What people are expecting from her. This is the realest thing I think Carlos is saying. Like, some people we want her to do better. She needs to be guided into doing better. She needs to be taught to do better. But what people are expecting from her coming from where she came from, that is a great expectation. You said I'm usually good about my care, but I did put off having my knee seen and ended up having surgery. I'm still trying to get back. Yeah, and my aunt right now. So one of my aunts, she just had her knee replaced, but my other aunt keeps on delaying getting her hip replacement. And I keep telling her, the more damage you're putting on, because she's like, oh, well, I just lean more to the other side. This is what she tried to tell me. I'm like, the more you're doing that, you're going to cause problems to the other side. And then you're causing more damage to the side that's already damaged. And that is going to impact your healing process. Like, what? Just do it. What are you delaying this for, right? Like, they're telling you to do it, and in the long, what are you going to wait? You're going to wait until it's so. You said, but her sisters seen, and some of them ended up just like her. That's what I'm saying. Some of her siblings ended up just like her, and then not all of them. I don't like. Look at how many of them act like her. And look at how many of them don't act like her. At least half of them act like her. And the other half, thank God they made it out, but they still have some issues too. They still have some retentions from that. And you got to think about, Chrisean is the youngest one. That's what I was saying. She's the youngest one. She is the youngest Malone child. She came along when her parents was at the peak of drug addiction. Some of those kids that were before her, their parents wasn't on drugs yet through a portion of their childhood. Chrisean was born in the peak of addiction. More than likely, she was born. I don't know. I don't want to go this far, but she might have been born with some addiction in her system, because she was at the peak of her parents' addiction. She was born at the peak of her parents' physical abuse. I just talked about how when they got taken from her parents, she had to go stay with her grandmother. Her grandfather was molesting her aunt, his daughter, her father's sister, and she ended up killing herself right there in the same house with the kid. It is a lot of them. They didn't experience homelessness. So you're talking about health care. How, like, if they homeless, if they don't have no food, if they don't have basic necessities, they're not getting the proper health care. So they just going off of that doctrine and just pray about it and go pray it away. Pray it away. You said, yeah, probably why she used to drink and drug so hard. Maybe. Like I said, it's a lot of trauma. It's a lot of trauma that they've come from. And the ones that have been able to overcome it, thank God. That's what you say to those. Thank God. Because if it weren't for God, so would I. That's what they need to be. The ones that were able to overcome that and probably had a little bit more better head start than her, because, like I said, they are a little older. And Charla was not in her addiction during that time. But the addiction, by the time Chrisean came along, like I said, the abuse that Chrisean's father inflicted onto Chrisean's mother was at the peak when Chrisean was born. That was when Charla was trying to be on her way out. And so the abuse got worse. So, and then some of those older kids, they were already gone out the house, already had families of their own, and probably prematurely, and probably shouldn't have been, but that probably is what kept some of their sanity, that they did not have a start like that in life. Like, they weren't born at 6 months, 7 months, 8 months with that type of neglect. You know what I'm saying? And so then sometimes a person can look at their own experience and say, okay, well, if I was able, because in somewhere in her mind, she thinks, okay, I had all of these challenges, but some kind of way I made it, even though it might not be the way I wanted it to, even though it's like this stain because of the way that I made it out of it. Still, I managed to like make it out of those hard times. And so in her mind, she probably think like, so will my child. My child will make it out of those hard times, right? Maybe that's what she's thinking. I don't know. With that type of doctrine that you learn growing up, that's what you hold to. It's retentions. When you think people historically have retentions from their heritage, from their ancestors that they never even met. And it's things that they still retained because it was passed down from one group to the other. So I can only imagine, and it's not making any excuse. I'm just trying to think logically. What are the things that could be getting in the way of this baby maybe getting a diagnosis? Even if he's like, because people are doubting that he's going to the doctor. I am telling you, I can tell he sees a doctor. I don't know how often. I don't know if it's all the time, but I can tell by simple improvements that he is seeing a doctor. And it might be that the doctor is only able to treat him for the clinical presentations. They may not have arrived to a diagnosis, a source that is causing all of this yet. That can be a difficult thing to arrive at. And so it was the reason why I wanted to come and talk to you guys about Ehlers-Danlos syndrome, because a lot of the things, just like we talked about autism, and we talked about how some of the things that we see presenting in junior could be consistent with a diagnosis of autism. There are lots of things with Ehlers-Danlos, and there are 13 types of Ehlers-Danlos, and a person can have more than one. But all of these things can impact the structure of his teeth, the connective tissue having a difficult time, so that would make it even difficult for him to not walk on time. You said, I don't think he's seeing anyone. He may get his vaccinations, maybe. I think he's seeing somebody just be. I understand why you don't think so. I wouldn't expect a lay person to think that he's seeing someone. I'm saying that I think that he's seeing somebody because I can see it. Like, I can see some improvements from when he couldn't do anything just a few months ago to now his upper body strength is much better. That means that he's getting something. I don't know how many times a week. I don't know if they've arrived at an actual diagnosis, or is it just an unspecified diagnosis. I'm pretty sure right now, if she said that it could be just that she doesn't want to share his diagnosis with everybody, and that's fine too. But she could be actually being told that they have not found out what the source of all of this is yet, because some of these genetic disorders are not something you just run a test for and say, okay, we figured it out. Some of these genetic disorders have to clinically present. You say he's just gotten stronger and that's what I'm saying. So I'm telling you that ever since whenever she decided to leave and come back to Baltimore, I'm not saying that she's been getting therapy for him for the whole time he's been born. I'm saying that since I can tell that something happened from the time that she left wherever she was after that fight or whatever, and she came to Baltimore, that there's something in place now, that there's something that he's getting. I don't know if it's once a week. I don't know if it's twice a week. I don't know if it's 3 times a week. I know that there is something that he's getting because I can see some improvement. And that improvement is consistent with someone who is getting therapy. And a lot of times, like I said, they give them techniques that they are supposed to continually to do at home. Sometimes with EDS, with Ehlers-Danlos, because most individuals with Ehlers-Danlos are going to be in therapy their entire life. That it's not gonna stop. They may have times when they'll be somewhat in remission and then not have to go as much because they can do their things at home. But then it's possible that then it'll come back, a different body part will start to be impacted, and then they'll have to come back into therapy again. So the overall goal is just to try to make best of whatever the situation is when you're dealing with someone who has EDS, Ehlers-Danlos syndrome. That's what it's called. Ehlers, EHLER, Danlos, DANLOS syndrome, right? And so these, just like when we looked at autism and how, depending on where he is on the spectrum, how that could impact it, Ehlers-Danlos is, to me, a even more a closer diagnosis, in my opinion, because it explains some of the connective tissue issue, the joints. Your joints are full of connective tissue. Your whole body needs connective tissue, but your joints are full of connective tissue. And based off of how contracted and stuff I was seeing his legs and all of these different things, I was like, there's something else that is happening. And so this might be one of the other possibilities. While everybody else, like I said, is focusing on what the environmental things are, I'm not saying that the environmental things are possible. I'm saying let's look past that and see if there's something genetic that could explain all of the things that we are seeing happen, right? And so as a result of that, it takes a long time for physicians to get to certain diagnoses. It might take years. Like people always hear about lupus. They always hear about multiple sclerosis and all of these conditions. Do you know that it could take somebody 6, 7, 8, 9, 12 years to get a lupus diagnosis or to get a multiple sclerosis diagnosis? They might present with all of the symptoms clinically, but until the diagnostic test or until that something comes up seropositive, they cannot be clinically diagnosed. They can only be treated for each individual symptom until they get that diagnosis. Because, and this is the issue, this is the problem. So, especially when it comes to multiple sclerosis, the types of drugs that are needed to treat multiple sclerosis, they are, and I hate to say it this way, but it's true, they are so toxic that they don't want to just give that to somebody who's presenting with symptoms and they think they might have it. So in a way, it kind of delays treatment, because when they can't get the diagnostic test or the blood test to show what it is, then they just have to treat the symptoms until they can get it to do that. Now with lupus, there are some treatments for lupus that they will go ahead and treat if clinical presentation confirms, but they cannot get it by any confirmatory tests, right? But when it comes to multiple sclerosis, there are certain multiple treatments for multiple sclerosis that you cannot get until it's confirmed, until the diagnosis is confirmed. So you might have all the clinical presentations, but until it's confirmed, you just cannot get it. You can't get the treatment. And so what they do is they treat you for all of the things that you clinically present for individually. And then they try to do what they can to keep you comfortable. And the reason you can't get it is because the insurance company won't let you. And most people cannot afford to pay whatever the treatment cost is to say, just give it to me anyway. Just give it to me anyway. I don't care what the insurance company says, because these medications cost a lot of money. Like my injections that I take for one treatment a month are $2,400 a month. That's for one situation. So some of these medications are way more than that. And that's how much my insurance pays. Imagine how much it's out of pocket. So a lot of times insurance is the way of getting to the right treatment. Insurance is in the way of getting to the right diagnosis a lot of the time, because they won't approve certain tests until certain other tests come back with something. And so there are so many obstacles when you are dealing in healthcare and trying to figure out what is going on. And so what practitioners generally do in order to try to provide some comfort, relief, and some form of care to their patients is they will use unspecified diagnosis codes in order to be able to treat their patients in the interim for the things that they clinically present for until they can arrive at a solid diagnosis. And so I just wanted to come out here and offer that to you guys, because I always want to be helpful and try to help you guys understand what I understand, and just like you all can help me understand what you understand, right? But I just wanted to offer that to say, listen, hey, I know everybody's beating up on the girl. She's probably she is batshit crazy. I don't take that from her. She's batshit crazy. She needs to get into some therapy. She needs to be in therapy. If we really want to really talk, she needs to be in therapy. And she needs to get you. You say you're the best, but that mama is trash. Yeah, she needs to be in some therapy dealing with her childhood, those traumatic experiences that she dealt with as a child that allow her to continue to be like this, that hasn't allowed her to evolve as this person. It's like Chrisean is existing like she's an animal. She's not existing like she's a person. She exists like she is a feral animal. And if you think about a feral animal, think about what I'm saying. And then you can understand, when you see a feral cat, do you blame the cat? What do you blame? Who put the cat in this feral position? That's how she is like an animal. And do you blame what is it? Where did that come from? I mean, like I said, you look at all of the things, the way she eats, the way she doesn't properly adorn herself and manicure herself and all. I mean, just all of those things. She is like a feral animal. And so if you have a feral animal that has a baby, what does the feral animal do? The animal, they do basic things, and then they think that they are doing things to like protect the baby because they don't know any better, but they might be putting the baby back in an environment that just is equally dangerous to the baby. I don't know. Like I said, she is like a feral animal, and she is not feral because of her, all on her own. And I think that the people who, because I listen to some people criticize her for not doing certain things for her mom, and what she was. That's part of the problem with Chrisean is her mom, okay? And I know people got a lot of sympathy for Charlie because she's an addict, but your addiction is why a lot of your children ended up the way that she did. And then I think that it is insane that people will judge her for what she doesn't do for her mom, or they'll bash her about what she's not doing about her mom's situation. But Tasiki gets a free ride. Tasiki is older than her. Tasiki doesn't do anything in order to try to assist her mom. Why do you think it's on Chrisean? Why do you think Chrisean is the one who's been doing things to try to help her mom? And I understand, like, some of the older kids, they've gotten tired of trying to help the mom. They have. But look at how people bash her. You say, yeah, that's not fair. Yeah, they bash her about the mom and the mom situation and all of this other stuff. But Tasiki don't get none of that smoke. Everybody keeps talking about the better situation that Tasiki is in financially. Chrisean is not just helping her mom. She's helping everybody in her family. They expect her to. If she doesn't help them, you want to know what they do? Come to the internet and bash her. And this is one of the criticisms that she has gotten from people around her is the reason why you got so broke is because you're giving all of your money out to your family members. Exactly, Just that's what I mean. She's not equipped to. Exactly, that's what I'm saying. You giving all of your money out to your family members, but then when you are in a bad way, where are all of those people? They not around. Only a handful. The one Tessa is around when you are in a bad way, but outside of that, where are the rest of them? We hear her on lives. They calling her, asking her for money. She's been taking, hey, just be boo boo. She's been taking care of Petey for I don't know how long, trying to make sure he has what he needs. And then Chastity, she better give Chastity some money, or Chastity gonna get on this internet and start talking shit, all types of shit. Like it's like she is also always expected to be the one to come through for the family. But the people love Tasiki. They don't see her doing none of that. You said Tareen not dealing with her and she was the best one to look out for Junior. I think, okay, so whatever Tessa had going on, Tess, because I know you skeptical with Tessa. Whatever Tessa had going on at that time that she did that, I don't know what that was about. I think that had to do with that court case she had going on and all of that other stuff. But I think that Tessa, I agree that Tareen was good. Tessa was good too. But yeah, she exactly. See, and that's what I'm saying. Just to be, all of these kids had some damage from their upbringing, but the level of it is different. And it's different because I think it depends on what was happening in Charlie's life at the time. And when Charlie first started off having these kids, I mean, listen, when Charlie first started off having these kids, she was not in no great way to be having no kids at that time. But she wasn't as bad as she was by the time she had Chrisean. When she had Chrisean, she was at the peak of everything: homelessness, addiction, abuse, physical abuse, all of that. And then there were so many allegations that the father, Chrisean's father, was molesting them. There had always been an accusation that he did molested the oldest one, but people were doubting the oldest one because they say she crazy and she talk crazy. And then it was allegations that he was doing things, to the other ones. Then you had as a result of that, I don't know if that led to a whole bunch of like the older kids doing stuff to the younger kids, because this is where you get this allegation of the Tasiki made Chrisean do something. Well, that's not the only person in the family that alleged that Tasiki made them do something. Chrisean is not the only one that made that allegation. There's another family member that alleged that as well. Then you got but it's not just them. It's multiple stories of this in the family. And then you have the story that she tells on Jason Lee that I had already knew in this verifiable, is that her grandfather, when those kids went over to, when they got taken from Charlotte, and they all went over to Chrisean's grandparents' house, because even the ones that did not belong to Chrisean's grandparents, they took them in with them too. And then by that time, the oldest one, she had kids, right? Yeah, they exactly. They all got some mental issue. The oldest one had kids. Her kids went over there because that one was in jail. And so her kids ended up going over to the grandparents' house. Well, during that time, like I said, that is when Chrisean's aunt got pregnant by the grandfather, the father's father. And that was her father. She got pregnant by her daddy. And she couldn't deal with it. And that's when she unalived herself. And these kids know about all of this. Like, imagine how much abuse was covered up, not discussed, not talked about. They never got no kind of help for it. Like I said, thank God for the ones that was able to get up and out and away from that and then do something with themselves. But knowing that, this child is like a feral cat. I'm sorry. That's just the reality. I mean, if I had to, she is like a feral cat. And for everybody wants her to do better. Everybody wants her to do better for her son. But she needs some therapy. She needs to be in some therapy. She needs some help. People need to try to stop expecting her to help a mom, go find a father, see where he at, because he getting high on some corner. Need all of that. Stop using her for content. Because you know that mentally something ain't connecting all the way up there, up top. Like, it's, I don't know. It's just a big ass mess. But at any rate, I hope whatever she is doing, I do hope that Junior is in care. I do believe that he's in some kind of care. I don't know if they are on target to find out what's exactly going on. I feel like he's being treated for some unspecified situation, which means he's only being treated for what he's clinically presenting for, depending on, because this is the thing. So the physical therapist is there to try to, the physical therapist, the speech therapist, the occupational therapist, the psychiatrist, the psychologist, they are going to be there to help deal with those issues, those individual issues, right? And the physical therapist is going to deal with both rehabilitative and habilitative therapy, right? But if he's not, if they're not finding out like what's the source, and he's not, because this is what also could be this is what else could be happening. He could be seeing the therapist, like the physical therapist and stuff like that, the occupational therapist, speech therapist, all of that. But he has to also see the medical doctor. And that it has to be some consistency with that. Like the type of care, he needs a lot of care in order to bring everything full circle. And what I can agree with you guys, I'm not sure, he might be getting the therapy because she might be focusing on him trying to meet those milestones. But unless he's seeing the medical doctor as diligently as he's getting therapy, then he needs to be doing both, is what I'm saying. And I can agree with y'all that I think that he might not be doing that now. I think that it is possible that he might not be seeing that medical doctor as much as he might be seeing the therapist, because see what the therapists are going to do is just focus on trying to make sure that he acquires these skills to his best ability. But the medical doctor is going to be the one coming with the hard truths. And that could be what she's avoiding. She could be avoiding the medical doctor, and still taking him to the therapy. So it could be a combination of things that she's doing or not doing or whatever. But yes, I just wanted to let you guys know that I want to get off here because you guys, Sylvia is going to be reading the transcript for Lil Durk, the Lil Durk trial, and she's starting off with OTF Jam. She is starting off with OTF Jam. Y'all, I think that Brian Steele, listen, OTF Jam ain't no little booty. You said, Lord, I hope he's immunized. Me too. But this is the thing. Nevaeh looked like one of those, I'm not getting my baby immunized mama. She looked like one of those. I don't know what it is, but it's like I can look and tell sometimes the type of mamas who saying I'm not getting my child immunized. Nevaeh looks like one of those, I don't get no immunizations for my baby. So while we hoping that Junior immunized, Nevaeh might not have that baby immunized either, because she looked like one of those types. Oh, this breast milk is enough immunity. He's getting it from me. He don't need to be no. You said I'm almost made me cry. I don't know how much more I can take. Almost made me cry. Listen, she does just. Yeah, she looked like one of those types. Yeah, this breast milk is the immunization enough, right? That's how she looks. But listen, Brian Steele, this is my prediction. He is going to. I don't know if they started cross-examination today or not yet, because I haven't got to look at much of the coverage, because I was looking at what was going on with that crazy ass TPD. I'm gonna talk to y'all for that about 5 seconds too. But I think Brian still gonna have a hard time with OTF Jam, because he ain't no Lil Woody. See, Lil Woody played around with law enforcement a lot, thinking he was finessing them. They knew him, they knew they could try to get him up on something and then try to go, ask him some questions, and he was flirting around with them, playing around with them and all of that shit, right? OTF Jam got a solid street record all the way up until now. This is a different beast. When Brian still thought he was going to pull out that bullshit about why didn't they record him, why didn't they record? They met with him 30 times, and why they didn't record? And he was saying that to the detective on the stand yesterday. OTF Jam cleared it up for them today and said, because I didn't want them to record me. They didn't record me because I didn't want them to. Like, I have a feeling this is going to be different. This is going to be, Brian's still going to work for every last one of them M's that he getting from Lil Durk on this case. I'm telling you that right now. This is not going to be no laid back situation. He's going to work for every last one of them M's that he's collecting on this case. This is, listen, when he told that story about the Halloween, when he shot the man on Halloween after the Halloween party at 9 years old. Listen, you said Jam Cop to 3. Yes, not sure what can exactly, just be exactly. That's what I'm saying. This ain't the same. This ain't no Woody. This is no Woody. And he is saying that he went to that place and he went up there to California. He did not know that he was about to go do no sliding on nobody. He didn't know he was going there to slide for nobody. That's what he says. That's consistent with what Dee Dee tried to say. Only I think Dee Dee did really know. And Jam probably the one who really didn't know. But I think Dee Dee probably really did know. But Dee Dee's whole defense is he didn't know why he was going there. And then when he was like, I didn't even know Vaughn. Like, I had no reason to want to, like, slide for Vaughn. I didn't know him. And then when he said that he was like, he'll never take no orders from Vonnie, that's some dirt shit to me. Because he has too much street credibility. Like you have right now, you have certified gangsters, right, that is talking about Jam and saying they cannot believe that this is happening right now. Men who sat down just like he did, who committed crimes, who now walking on the street knowing they committed crimes the same way he did. And they are saying that they cannot believe that he is even up there doing this right now. So that's letting you know that his track record is good all the way up until now. That is different than somebody who is always running around talking up with the police, flirting and laughing with the police like Woody or like Keefy D. I mean, that's a whole different story. You said dude was only 3 years old doing 12 years. You said dude was only out 3 years after doing, yeah, his life is so very, very, that there's a guy who says this happened because Dirk didn't pay and get him a lawyer. Maybe. And especially after, because they mentioned something. I heard today that it was something mentioned about that. He said that Dirk said he was willing to put like 50 million or something in the ring to do a fight with 6ix9ine. And they all looking like, how the hell you about to give this nigga 50 million to fight? And you didn't gave us just a couple thousands or whatever to do a whole murder. To vindicate your boy. Like, I think he feel, yeah, I do too. And the fact that he was, when he started talking about, he didn't even know that that's what he was going there for, that when he got there, they just gave to say, oh, we only got 3 guns. They give him the 3 guns. They assign him to who they assign him to. And he said, and then at that point, you know, coming from the neighborhood, not to get in the way of no plot, because if you do, you could end up being plotted on. He was like, I would never take no direction from no Vonnie. Like him and Brian Steele, they gonna have a time. They gonna have a time. This is not gonna be the same type of cross-examination process that they had over there in YSL. This is not that. This is gonna be something different. Something different. You said they were not friends previously. Dirk knew about him and started name dropping. Yes. And so, Dad, you want to know what that made me? That did make me think about when Woody said that Young Thug was doing that to him and putting his name and telling off on him, snitching off on him in his raps. When Jam said that, when OTF Jam said that, I said, you want to know what Lil Woody was saying? The same thing about the Thug doing that. Yeah. I mean, just a hot mess. A whole hot ass mess. Like, I mean, and when the reality, when you look at it in a way, they put them off in the snitching position. They put them off in the snitching position. Like, you send OTF Jam to go do this thing with people that he don't even know. He don't even know these people. You put him on a plane. He's saying he didn't even know that that's what he was going there for. He gets there thinking that he's going to be in a music video. Because that's what he said. Now, he could be lying, but this is what I feel. At what point do he have to lie at right now? None. What kind of deal they give him? Whatever kind of deal they give him, he still will be behind bars the rest of his life, I think. I don't think that whatever kind of deal they gave him, I can't see it being something that's going to, like, let him get out of jail for what he pled guilty to. So, you said, I just can't imagine dedicating my life to being another man. Exactly. But like, imagine that you're raised up that way. It's just like those people that's raised over there and to the Taliban or Al Qaeda or the Islamic State, ISIS and all of them. Like, this is how these people are growing up over here in the United States. That is why I always encourage people to read Chris Hayes' book, A Colony in the Nation. Chris Hayes, one of MSNBC's commentators, he wrote a book called A Colony in the Nation, and he talks about how the hood is not part of the nation. It is a colony in the nation. And he talks about how the over-militarization of the hood, how that impacts people growing up in it. He talks about food deserts, income disparities, access to care, access to proper health, childcare, how all of these things look different in the colony than they do in the nation. And he talks about what a colony looks like versus what a nation looks like. And that's how a lot of these people are growing up. You said, no, Jam said he had no idea why he was going. He would, yeah, right. That's what I'm saying. He said he didn't even know. I think because he said something about knowing that they were shooting a music video or something, I think. And then because then he said that he got paid $10,000 for being in the music video, that he never had any understanding that he was getting paid to go do some shooting of someone, but that he got paid $10,000 for being in the music video. And so then they said what they were saying coming out of the courtroom was that he was saying that he thought if he didn't do what he was told, that then he wouldn't get to be in a music video to get paid the money for that. And something about, I think somebody came out of that and said something about that the music video was supposed to be something about him. I don't know if it was another music video where he was being mentioned or a music video where because he don't rap, do he? I don't know. I don't know. You say someone needs to explain to me if gangs are this popular in all cities. I had no idea this stuff was going on. I think to some degree, different types. Like even if they don't call themselves or consider themselves to be a gang, it's still like in the inner city, any place with an inner city, it's something going on. Whether you just repping your block, like it's something going on. You said Jam also said that everywhere they went, he got a pow. Yes, they Dirk said to make sure he had one. Yeah, I didn't even know if he rapped or not, but I called somebody that was, I can't remember who it was. When I was watching them on Twitter, when they came out of the courtroom and was giving an update, they said that the rap, I don't know if they were saying that the rap video that they were in was supposed to be featuring him, or if the rap video, if it was something in the rap about him and that's why he was supposed to be in the video. But yeah, this is a mess. It is a hot mess. And then Keefe D, I don't know whether they should have put that Detective Long on the stand, Lord. I don't. I mean, I feel like Keefe D did this. I'm waiting to see what Suge gonna have to say when he hear them two people that was, playing moonlighting and security on the properties, that they talking about a white Cadillac came up into the property that night. A cream colored Cadillac came up onto his property that night. I cannot wait until she'll get whiff of that. He is going to be blowing TMZ up, because here it goes again. Keefe D telling off on him, snitching off on him, saying that he did something. That's what it's insinuating, like he was part of something. And that's what I'm saying. Suge did all that and didn't come testify, talking about he ain't coming to testify. He gonna be a hostile witness. But then you still got this nigga still trying to tell off up on you and trying to tell something up. Keefe D is just a big fat ass snitch. A big fat ass snitch. And I don't even care about snitching, but Keefe D is a big snitch. I'm sorry. Did you see that they said that the son hit up Wet 100? The son hit up Wet 100 saying that, oh, you said my dad was cooked and he about to get off on this, and I'm gonna make sure when he do, I'm in charge, and he don't be talking to no bitch ass niggas. I guess basically trying to say my dad ain't coming over there talking to you after he get off on this case. And so Wet basically was like, if he is essentially. Wag might eat them words, because like I said, that's why I said, listen, I think Keefe did it, but I ain't saying he gonna be found guilty of it. If I was on the jury, listen, I would be a holdout, because I think it's enough. He didn't put his own self there. His testimony is evidence to me. Okay, that book, that's testimony, that's evidence. All of this stuff is evidence. Your words you said, your all of these stuff you've been saying on this jail phone, and then these proffers, and you talking to these people and all of these interviews and stuff. Listen, all of that is evidence to me you did it. You said you did it. Ain't nobody make you say you did it. Now, you said it. Ain't nobody make you. Why you ain't say you killed Biggie? Why you ain't lie about that? No, you lied about Tupac when they didn't even ask you nothing about Tupac. So, or you claiming you lied now. So I don't believe it's no lie. I believe it's the truth. I think that's why Corey Edwards went on a damn run, because he didn't want to have to be the one that was going to end up sealing Keefe's fate. And that interview, whatever statement he gave to them people in 2006, I think it was consistent with whatever Keefe D said in those proffer rooms and shit. And so I think that's why he went on the run. I don't know where all the witnesses went, but these people got out of Dodge. I don't know how the prosecution allowed that to happen. And if I was the person that was in charge of this state's attorney's office, they would be fired. Every last one. All of them. Fired. You said, son, you can't stop your father from talking. No one can. That's why exactly. And where did he get some $1 million to offer to Suge at? So either Suge, you lying, and Keefe ain't offered you no $1 million, or Keefe, where did you get $1 million from? Where did that come from? I'm confused. Right now, you got a lawyer, a pro bono lawyer, because you can't get along with nobody, and you didn't have the money to pay the lawyers that you had. But all of a sudden, you got some $1 million to be offering to Suge. This whole thing. This is like that's another circus. The whole thing is another circus, you guys. But listen, I'm gonna get over here so I could go over to Sylvia's and see what she's reading for today and try to get myself caught up on the Yellow Beezy trial. I did like hop in there today. It's this girl. She understands. She is telling a whole lot. She volunteering people that she know that they ain't even ask her about. She's like, oh yeah, no, judge, I know them too. And I went to school with him too. Because the judge was about to stop them from asking questions about one particular person. And she was like, I know them too. I know, I don't know who they, but right now, the trial is for the shooter in that case. So I think the judge said immediately after that trial is over, then it will start the trial with Yellow Beezy. Then here's the start immediately. So right now it's the shooter that is standing trial. And then I guess as soon as that, I don't know if it's supposed to be the same jury, if they pick a new jury. I gotta try to find out the details. But and maybe Tiz know. Tiz, let me know what order it said it's in. All I know is that right now they say it's the shooter, and then next it'll be the thing. You said he was going to predate yeah, because he said on that phone, if we make it out of this one, when I get out, we gonna be rich. You heard him tell that today. I think it sounded like he was talking to that lawyer Higgins, because that sounded like Higgins on that call when that one that they played. But he said, if we make it out of this, we gonna be rich. So I guess maybe just he was gonna predate a check and just tell Shook, just hold the check and I'll tell you when to cash it. Like Bo Brindley. Bo Brindley writing all them badass checks to them people, acting like he paying them back, and then they go to deposit that check and that shit bounced. That's what KBD was about to do. Right sugar goddamn check that was gonna bounce. He said, shaking my head, he's gonna get him some. Yes, exactly. All of that damn talking and running his mouth that he doing. I hope he don't go telling himself off on no other crime. And we want to know what? I hope that, listen, I don't know what's the expiration date or none of that shit. I'm not going to claim to be on none of that other crimes he was snitching off on. But I wonder if they could go and lock him up for some of them other crimes that when they made this deal with him and all of that stuff that he was confessing to. That's going to really have Keefe sick if they could do that. If they could get, if it's a way, I don't know if they can. I'm not saying that they can. I just don't know. I'm wondering, like he done already violated the proffer. So can they go back and get him off on all that other stuff that he was willingly, because all of that drug shit, he was connecting all the dots for them on that. So I'm wondering, can they go? I don't know how far they can go back. I don't know I don't know if they can go back, if whatever. But he better hope they can't go after him for none of that, because he didn't already steal this fate, all of the shit he done told off on that. All of the bragging he doing about all them drugs he was selling, exaggerating the amount that he was selling. Not that he wasn't selling enough. I mean, he was selling enough for the actual amounts that they were coming up with. But for him to be just bragging and going on over top, Keefe is a mess. He is a. Listen, I don't know how I feel about this, because I really did. I just want him to shut up and sit down somewhere. If they won't let him out and he go shut up and sit down somewhere, I'll be okay. But my fear is that this nigga is not going to just go shut up and sit down. We ain't gonna never stop hearing this nigga talk down. He gonna be all plastered everywhere. And that series that he was trying to make, like he Power, like he making a series like Power. Got a contract in his car with some people to make some kind of series like Power. Like he 50 Cent. This he got a contract to do some goddamn series like Power, like he 50 Cent, but this nigga education level ain't worth 50 Cent. I mean, I don't understand. So y'all, I keep saying let me get off of here. I hope you guys have a great evening. I will talk to you guys soon. We got so much things to talk about. We got to get caught up. I'm trying to get caught up with you guys on the weekend. I don't know if I'm going to be able to come live tomorrow at all. But if I will, I'll try to give you guys enough time. But if not, I will catch you guys sometime on the weekend. I love you guys. Y'all have a good evening. Peace.